So hello, everyone, and welcome. Thank you for so much for joining us for today's webinar, Life Interrupted, Pulmonary Arterial Hypertension's Impact on Work and Activities. I'm Robin Calda, and I'm the Manager, Research and Policy at PHA Canada. I'll pause here for a land acknowledgement. We have people joining the webinar today from many locations, coast to coast. PHA Canada acknowledges that we operate on the traditional and unceded territories of First Nations, Inuit, and Métis people, whose rich and diverse cultures, languages, and histories continue to shape this land we now call Canada. We recognize the deep and lasting impact of colonial history and are committed to reconciliation through education, reflection, and meaningful action. The land on which I plant my feet, now called Toronto, is the traditional territory of nations including the Mississaugas of the Credit, the Anishinaabe, Chippewa, the Haudenosaunee, and the Wendat, and is now home to diverse settler and Indigenous peoples. In the spirit of the Dish with One Spoon Wampum Agreement, I recognize my responsibility as a settler to help deconstruct the colonial systems that prevent this land and all lands from being sustainably shared for the benefit of all beings and maintained as a healthy ecosystem in its own right. I'm going to present some report results, and then once I'm finished talking, we're going to have a great lineup of speakers. Kristen Weedmark is a staff lawyer at the Disability Law Clinic, a program of Disability Alliance BC. The Disability Law Clinic provides a free, confidential summary advice and referral service directly to people with disabilities across BC on certain disability-related areas of law. Kristen advises clients in areas including human rights and accommodations, long-term disability insurance, and adult guardianship. Kristen's going to give us a nice overview of some of the main themes she sees in her work. We also have two members of the pulmonary hypertension community, Maureen Harper and Kate Salonga, here to tell their work-related stories, so you'll see their faces a bit later on as well. And we'll end with a Q&A session. If you have questions for Kristen, please remember to keep them general because she's not able to give personal legal advice in a webinar. To start off with, I'm going to spend a few minutes giving you some highlights from our last Burden of Illness survey report, which was released last year. You can find it on our website at phacanada.ca. Just look in the research section and look under Burden of Illness, and it'll take you to a page where you can download it. Or you can just use the QR codes on this slide, which will take you right to the report in either English or French. So in 2023, PHA Canada and the Canadian Vigour Centre at the U of A did a survey looking at the financial and employment impacts of pulmonary arterial hypertension in Canada. So in the end, 217 patients, not 20, 217 patients across Canada were included. So it's their responses we'll be talking about today. I'm just going to show a few highlights that are specifically related to the work aspects, since I don't want to dull you with all the numbers in the report, but there's a lot more in the report, including some patient stories. So only 28%, so a little over a quarter of pulmonary arterial hypertension patients surveyed said that they were working. Of those not working, half were retired and nearly a third reported being disabled. And of course, people could be both of those things at the same time. A large majority of respondents, nearly 9 in 10, said pulmonary arterial hypertension limited their career options, and about 4 in 5 said PAH affected their progress in their career, which is particularly an issue for younger people at the start or in the middle of their careers. 2/3 said PAH affected their ability to keep a job. So already we can see that PAH has a big impact on people's work lives. We also saw that people with pulmonary arterial hypertension had changed their work patterns. 61% lowered their hours at work, 45%, so nearly half, changed from full-time to part-time work, and 26% even turned down promotion because of their PAH. PAH even affects whether people stay in the workforce at all. 48% of respondents considered quitting their job, and 45%, so again, nearly half, actually did voluntarily quit working at their job. And finally, 46% took early retirement. People's workplace attendance and productivity were affected more and more as the severity of their pulmonary arterial hypertension increased. On average, though, people with PAH missed about 5 hours of work time in the week before they completed the survey, and they reported that their productivity was down by about 2/5. PAH has substantial financial impacts even beyond work. There's many expenses, including travel to clinic appointments, parking, a professional caregiver costs, and many other things. Reliance on professional caregiving services increases dramatically for the most severely affected PAH patients. Some 43% of patients reported receiving financial support from the government. This was up from 35% in a 2021 survey. It'll be interesting to look at the reasons behind that. And finally, 1 in 10 people reported not taking a prescribed medication for their PAH because it was too expensive. 45% of respondents, again nearly half, indicated that due to pulmonary arterial hypertension, they currently require the help of a caregiver who's their partner or spouse about 3/4 of the time, and possibly also their children about a third of the time. The caregivers of people with PAH have their work and their finances affected too. Caregivers lost an average of 9 hours per week of work time because they were caring with their loved one with PAH. And if people are sicker, they need a lot more help. Caregivers to the sickest PAH patients reported spending an average of 43 hours a week helping with daily activities. So that's an extremely brief overview of some of the ways pulmonary arterial hypertension affects the work lives and finances of people and their families. If that piqued your interest, I'd encourage you to have a look at the full report. And again, you can find it in the research section of our website. And now I'm going to stop sharing my screen and turn it over to Kristen to talk about human rights law and employment. So just give us a minute while we all find the right buttons to push. Okay, over to you, Kristen.
Thanks, Robin. Okay, I'm just going to share my screen. Okay, so hi everyone. My name is Kristen Weedmark. I'm a staff lawyer with the Disability Law Clinic, which is a program of Disability Alliance BC. Today I'm going to talk a little bit about some of the main issues in employment and human rights law, and really focus on the duty to accommodate people with disabilities in the workplace. I do want to start off just by acknowledging the land that I'm on today. So this presentation is broadcast from the Office of Disability Alliance BC, which is located on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm grateful for the opportunity to live and work on these lands, and I recognize my responsibilities as a settler in these lands as well. So just a quick outline of the presentation today. So first I'll give a bit of an introduction of Disability Alliance BC and the Disability Law Clinic. I'll then talk a little bit about human rights in the workplace and focus on some important concepts like disability, discrimination, accommodation, and undue hardship. We'll also talk a little bit about the duties and the responsibilities of employers and employees in the accommodation process. I'll then go over some examples of workplace accommodations and talk very briefly about human rights complaints. So Disability Alliance BC has been a provincial cross-disability voice in BC since 1977. Our core services and activities include providing one-to-one services to people with disabilities, working with community partners and all levels of government to advocate for systemic change, designing and implementing new projects and programs to meet the specific needs of the disability community, providing educational workshops and webinars to community groups, government, and individuals, and creating free publications and resources focused on disability-related issues. Our mission at DABC is to support people with all disabilities to live with dignity, independence, and as full and equal participants in the community. We champion issues impacting the lives of people with disabilities through our direct services, community partnerships, advocacy, research, and publications. The Disability Law Clinic is a program at DABC. We offer summary advice and referral services to people with disabilities across BC. Specifically, we help people with understanding accessibility laws like the Accessible Canada Act and the Accessible BC Act. We help people with disability-related human rights cases, including disability and employment-related issues. We advise people on access to services, including post-secondary education and public transportation. We also advise on accommodations in the workplace. We advise on decision-making rights, especially in cases that involve the public guardian and trustee of British Columbia. And we also advise on legal issues that are related to disability insurance benefits. Just one limitation we have is while we do help people with accommodation in the workplace and disability-related human rights cases, we unfortunately cannot assist people who are members of a union. So now I'll just give a bit of an overview of human rights laws in Canada. Both provincial and federal legislation protects against discrimination based on disability in the workplace. And so I'll start with just a few definitions here. So discrimination under human rights laws is any action or decision that's related to a person's disability that causes a negative impact. Examples of discrimination, if they are done for reasons related to a person's disability, can include firing someone, reducing a person's salary or benefits. It can include bullying or harassment in the workplace, and it can also include failing to offer reasonable accommodation. Disability in human rights law has a very broad definition. I do want to note that disability under human rights legislation does not require a specific diagnosis. Human rights laws cover disability even if there is no specific diagnosis, as long as there is some kind of limitation or barrier that is impacting a person in their work. So disability can include mental, physical, and learning disabilities. It can include visible and invisible disabilities, and temporary and permanent disabilities. And I also want to note that this definition of discrimination, it also applies to actions or decisions that are related to other protected grounds in human rights legislation. So along with disability, other protected grounds in human rights legislation include race, religion, sex, sexual orientation, and gender expression. The exact list of prohibited grounds of discrimination does vary depending on which province you are in and whether your employer is federally regulated. But ultimately, all Canadian human rights laws do protect people from discrimination on these grounds or on grounds that are very similar. I also want to note that these examples on the screen, so for example, firing someone, reducing a person's salary or benefits, bullying or harassment in the workplace, and failing to offer reasonable accommodations, on their own, these are not necessarily discrimination. These actions are only discrimination if they are connected to a person's disability or one of the other protected grounds in human rights legislation. And this is how avoiding discrimination is connected to an employer's duty to accommodate people with disabilities. So in order to avoid discrimination, every employer has a duty to provide reasonable accommodation to the point of undue hardship. So sometimes treating people fairly means treating people differently from others, and this is why the law recognizes that duty to accommodate. Accommodation can look different in every situation, but it can mean, for example, changes to equipment, practices, or policies that would enable an employee with a disability to succeed in the workplace. I also want to note that this duty to accommodate is a responsibility to take reasonable steps to provide accommodation that an employee needs to do their job. The idea that an employer's responsibility to accommodate only applies to reasonable steps is connected to the idea of undue hardship, which we'll get into in a moment. But the word reasonable is really important here. The legal obligation on an employer is not to provide perfect accommodation or even necessarily the exact accommodation that an employee has requested. The duty is to provide reasonable accommodation. And what that means is generally an employee cannot reject a reasonable offer of accommodation unless they have a good reason or can show that the suggested accommodation would not be reasonable for them. And so I want to talk a little bit about this idea of undue hardship as well. So undue hardship is a limit on the employer's duty to accommodate an employee with a disability. If an accommodation would cause undue hardship on an employer, the law does not require the employer to give that accommodation to the employee. Typically, an employer can expect to incur some hardship in providing an accommodation. For example, there might be some cost if extra equipment is needed. There might be some inconvenience if, for example, an accommodation is allowing an employee to work from home more or have more flexible hours. But Cost and inconvenience on their own are not generally enough to show undue hardship, and an employer is only justified in refusing an accommodation if it can show that it would incur undue hardship as a result of that accommodation. I also want to explain that undue hardship in the employment context is fairly rare. In most cases, an employer can accommodate an employee's disability without reaching that undue hardship threshold. And the law weighs several factors together to decide what counts as undue hardship for an employer. So the law will look at the financial cost of an accommodation. The law will also look at any health or safety risks that might be associated with that accommodation. The law will look at the size of the employer and the resources that are available to them. So, for example, typically a larger company will have more difficulty showing undue hardship compared to a smaller business that might have more limited resources. The law also looks at the impact on the rights and interests of other workers as a result of any accommodation. I also want to note here that mere inconvenience or disruption to other workers is usually not enough to count as undue hardship. There usually needs to be something more, some more significant intrusion or disruption onto the rights of other workers. So now we'll talk a little bit about the employee and the employer's responsibilities in the accommodation process. So if an employee requires accommodation, they should start by telling the employer that they need accommodation. In doing this, they should explain how their disability affects them in their work so that the employer can understand what accommodations might be reasonable for them. This might require medical evidence about the employee's limitations at work and the employee's compliance with their treatment plan. However, I do want to clarify the employer does not need to disclose a specific diagnosis or any medical information that is not related to the request for accommodation. There's a bit of a balancing act with providing enough information while also protecting the employee's privacy interests. So the employee does have the duty to provide the employer with enough information so that the employer can understand the nature and extent of the employee's need for accommodation. The employee also does not need to disclose any details of their treatment plan other than just advising whether they are following it or not. So that's more like a yes or no answer. No employee needs to give any details of any therapies or any treatments that they are receiving. And if an employer asks, an employee, in most cases, will not be required to provide that information. So part of the duties of the employee are also to participate in the accommodation process. So the employee has a duty to consider an employer's accommodation offers in good faith. And so what that means is that the employee should give the offer a fair chance and only reject the accommodation offer if there is good reason to show why that accommodation would not be reasonable for the employee. This goes back to that idea that an employee is entitled to reasonable as opposed to perfect accommodation. And for example, an employer might be able to show that there was no discrimination if they can show that they offered a reasonable accommodation to an employee, but that employee rejected it. And just as a practical note, whenever possible, it is best to communicate with an employer about accommodation in writing, just so that there is a record of that conversation. But if you ever are in a situation where it's not possible to communicate in writing and you do end up having a verbal conversation, you could also consider writing a note about the conversation either for yourself or send an email to the employer, just with details of who the conversation was with, when it was, and details of the conversation. Just like a key summary of what was discussed and any decisions that were made as a result of that conversation. If any legal dispute does arise, it would be helpful to have that record in writing. So if an employee discloses that they have a disability to an employer, the employer also has certain responsibilities. So the employer should consider what accommodations they could reasonably offer to that employee. If the employer needs any further medical information about the need for accommodation, they can request that from the employee, but they should only request the information that they need in order to determine how to accommodate the employee. They're not entitled to any information about a medical condition that is not related to the employee's need for accommodation. If an accommodation would amount to undue hardship for the employer should consider whether there are any other possible alternatives that might be feasible. So for example, if a person is unable to complete the core duties of their job, the employer might look at whether or not there's another job opening in the company that might be more appropriate for that employee, or whether there might soon be a job opening. One limit to this is that typically an employer does not have to create a new job position for an employee as part of the accommodation process. So some other duties of the employer are to maintain confidentiality about the request and the employee's disability. If disclosure is made to a manager, it might be reasonable for the manager to inform HR so that there is more of a record a little bit higher up in the company. But details about an accommodation request or a disability should not be shared with anyone who doesn't need to know about it. Part of the duty to accommodate is also to respond to requests in a timely manner. Sometimes an employer does need further medical information, and just kind of as a practical reality, it usually takes people some time to get in to see a doctor and get a medical note. And so both parties ideally should respond fairly quickly so that the process can continue moving forward and proceed smoothly. I also want to note that as part of the undue hardship analysis, an employer cannot reject a request for accommodation without considering it first. So an employer does have the duty to look into what accommodations might be reasonable and have a conversation with the employee about what might work both for the employer and the employee. As part of that undue hardship analysis, the employer would have to show to reach undue hardship that they had done everything they could to accommodate, and any further accommodation would amount to undue hardship for the employer. And so that necessarily requires the employer to actually look into the accommodation requests and see what is reasonable for the employer to provide. The employer also has what's called a duty to inquire about a potential disability. So this comes up if an employer notices that an employee is struggling at work and the employer has reason to believe that that might be related to a disability. The employer should go and talk to the employee about the potential existence of a disability and the need for accommodation before taking any disciplinary action against that employee. And so, for example, if there's an employee who was previously able to do certain tasks like lift heavy objects or do like mathematical equations, and the employers notice that this person is struggling with things that they previously were able to do, the employer should ask if that person needs any sort of accommodation in their work. So then I want to talk a little bit about disclosing disability. That can be a really big decision for a lot of people, and is not always an easy decision to make. And so when considering whether or not to disclose a disability, the most important factor to consider is the employee's ability to do the job. If an employee's disability will not impact their ability to do the job, they don't need to disclose their disability to the employer. However, if an employee does need accommodation to do any of the duties of the job, generally they should consider disclosing to the employer. And this is because typically employers only have the duty to accommodate disabilities that they know about or reasonably should know about, which is kind of related to that duty to inquire. And so there's a bit of a risk in not informing an employer about a disability, just in the sense that if there are any issues, any performance issues or things like that, the employee might not be able to rely on human rights legislation to protect against discrimination, as the employer does not have a duty to accommodate a disability that they don't know about. And so if an employee is asked about the ability to do any of the duties of the job, either at a job interview or another conversation with an employer, they should respond honestly. However, the employee is not required to tell the employer their diagnosis, the name of their disability, or any details of their treatment plan. They're also not required to tell the employer exactly what accommodations they need. Sometimes an employee does know what accommodations would be helpful for them and can make that request to the employer. But in a lot of situations, an employee might notice that they're struggling at work, but not know exactly what kind of supports they need to help them. And so in that case, just telling the employer that there are some kind of limitations and that accommodation might be needed should trigger that employer to start looking into what accommodations might be reasonable, and then to go to that employee and have a discussion with them, or at least let the employee know whether they could or could not accommodate. The idea is that both sides work together to come to a solution that works for both of them. So I'll just go over some examples of workplace accommodations. And accommodation, it's different in every situation. So this is not an exhaustive list. Accommodation can be pretty flexible. It can be very creative. It really depends on the person, the employee's disability, and then also the resources of the employer. So some examples of workplace accommodations include modifying duties, like allowing an employee to take more breaks throughout the day, or having more frequent check-ins with a supervisor, or changing how information is shared. So for example, sending an email with instructions instead of having a conversation with someone. Other examples of workplace accommodations can be modifying the work area, which might include an ergonomic assessment of the employee's workspace to see if there are any ergonomic barriers or challenges that could be addressed. Another example could be changing the lighting in the workspace, or even moving a work area to be closer to required equipment. So for example, if someone typically works at a desk but uses a printer or a fax machine, they might move their desk to be a little bit closer to that area just to kind of reduce the amount of time they spend on their feet going back and forth between their workstation and a printer or a fax machine or anything else that they might be using. Other examples can include providing special equipment like screen reading software, earphones or microphones, a hands-free telephone, an adaptive keyboard, really anything that would work for the employee who needs that accommodation. Other examples of accommodations can include giving time off to access treatment. And so that could be a few days here and there for appointments, or it could include a longer leave of absence. I also want to note there's no limit to the number or the type of accommodation that can be requested. So disabilities change. They sometimes fluctuate. They sometimes get worse. They sometimes get better. As things change, additional accommodation requests can be made, or previous accommodation requests can be modified. The one thing I do want to mention about that is that might require more medical evidence. However, there's no limit to the amount or the type of accommodation that an employee could request. And so what to do if an employer refuses an accommodation? So our first suggestion is to communicate clearly and consistently with your employer and healthcare providers. It sometimes takes a few requests before an accommodation is implemented. Sometimes an employer needs more medical information, and just with the time limits of a person making a medical appointment and providing that information might take a little bit. There might be some back and forth communication about what would work for the employer, what would work for the employee. So it sometimes does take a little bit of time. But sometimes even after multiple requests and conversations and clear communication, sometimes employers still don't provide that accommodation. And so in that situation, if you're a member of a union, you could consider speaking to a union representative. You could consider filing a human rights complaint or seeking legal advice about the situation you're in. If you do consider submitting a human rights complaint, it's important to note that most employers are regulated by the provincial or territorial government. And so complaints should go to a provincial or territorial human rights tribunal or commission. But for employers who are regulated by the federal government, complaints go to the Canadian Human Rights Commission. And so some examples of federally regulated organizations include federal government department and federal crown corporations, air transportation companies, including airlines and airports. It includes banks, First Nations governments, radio and television broadcasting companies, and the RCMP. But employees who are members of a union also might be able to enforce human rights laws through the grievance arbitration process if their union supports them. And so for further information on disclosing a disability, DABC has released a guide called Disclosing Your Disability, a legal guide for people with disabilities in BC. It is available online, and it has kind of some more advice on when and how a person might consider disclosing a disability to an employer. And it kind of focuses more on people who are at the interview stage of a job search. I'd also recommend checking out the People's Law School webpage on the employer's duty to accommodate for some information on what that duty to accommodate looks like. And thank you very much. I'm happy to turn things over to the other panelists and answer any questions that might come up.